So would you please introduce yourself shortly and tell us what you're doing?
I'm Dr. Nam. My full name is Dr. Namperumalsamy. I'm the Chairman Emeritus of a social organization called Aravind Eye Care System, which was started about in 1976 to serve the people mostly in the rural areas who cannot come to the cities, and also because most of them cannot afford and they don't know that they have eye disease, and somebody has to come with them, economically poor. And in our country, the doctors are all concentrated in the major cities. They don't have, so there is a disparity, distribution of service come what the people need. Definitely there are eye care services in India, but most of them are private services, which is very expensive, and public, run by the government. It has got the services, but there may not be the one state-of-the-art technology or something. So what we thought was we should give to these people in rural areas the quality eye care services for the money they can afford, and also to get rid of the backlog of blindness in the country, because India is supposed to be having about 12 million blind people, and so we have to start somewhere, and that is how we started this in 1976. And most of it, the people cannot come to us. When they are not able to come, we thought that we will arrange somewhere to reach them in their own areas by going to the community. Ours is mostly a community-oriented, working with the community. And also we collect money from the people who can afford to pay to serve the people who cannot afford to pay. In that way, about 60 to 70% of the people, we give them free of cost, all the services. And we charge from the patients about 30 to 40% of the people, whatever they can give. But definitely they are able to give money. And and we do our services effectively, in the sense we do large volume of these services. So the turnover of these people who can afford to pay give us a large revenue, so that we could give service to the people who cannot afford to pay.
Okay. It sounds to me just a little bit like a bank, so that people who can afford invest the money and get a small revenue for the investment, so the poor people can get their eye operation. We would call it just a little bit like Robin Hood. You know Robin Hood?
Exactly.
To take it from the rich and give it to the poor?
Yeah, but not forcibly. We don't take it forcibly. Yeah. The people who can afford to pay, they know pretty well. It's transparent. The money they pay is not only for their own eye care, but also they give money for the people who cannot afford to pay. And we charge the money just like charging for the same product of giving good vision. People who want to have a good, comfortable stay at the hospital, they want good food and stay in the hospital, they end up paying more. But they know pretty well that this is the amount. It goes to we don't take it, as we were the founders, but we don't take it, but the money goes to the people who cannot afford to pay. What we call, this is again an innovation, what differential payment for the same product. They give money which is different depending upon the luxury and comforts they enjoy at the hospital. Yeah.
So you are the founder of the organization?
The founder is there's another, my professor, but we are all the founding members at the same time.
Too close because it's
okay.
too loud.
I am one of the founding members of the organization, but the founder chairman is no more. He passed away 2 years ago. But we continued from 1976 with the institution. I still continue with that organization.
Do you know where the idea came from? So you don't sit on the balcony and have the idea to cure India from blindness. So it's a developing idea, or was it just a spot in?
No, this idea is there because the problem, social problem, exists in the country, and our professor or our founder has worked when he was in the government service. He was a professor of ophthalmology, and he had the idea that people are not able to come. They have barriers of coming because they don't have food. They need somebody to come with them, and they are illiterate, and they are intimidated to come to the major cities and even that, but they don't know that treatment is available. So his experience, he wanted to continue even after retirement from his government service. He retired at the age of 58. That is the mandatory in our government. So when he retired, he thought that let us continue in a private area in the same way as we will reach the community. And we will not go for fundraising. We will get revenue from the same people, from the community who can afford to pay, to the community who cannot afford to pay. And that is the innovation which helped us. Even today, we continue the same principle of not fundraising.
So many innovations are older than you think. Your organization is a proof that social business is no idea of the 21st century. So it's 1976. At that time, nobody talked about social business, social impact business, social entrepreneurs. It was just a man who saw a social problem and wanted to solve it.
Yeah, that is what it is. Always people think that we don't have money, so how are we going to do that? But you find ways of finding money in the sense you make use of available resources to the maximum. We don't have enough number of doctors, but keeping the doctors, you can train the paramedical force to help you in a maximum way, that only medical services are given by the doctor, but all the paramedical services are given by the paramedical force at a low cost. And instead of doing 20 surgeries per day, you do 200 surgeries per day by the same operating room, same equipment, same air conditioning, same electricity, and it will cut down the cost. And so, but in order to do that, you have to do the social marketing that these patients need surgery. If you give surgery, they will get back the vision, and they go back to their work, and then they can earn money for their family. They can earn money for the nation, and that way you have to teach all the things. That is called social marketing. So when you create a demand, they come and you reduce the cost. And also you will be knowing that after the major cause of the vision impairment is cataract, clouding of the lens inside the eye. After removal of the lens, you have to put an artificial lens inside the eye. The cost of the lens about $150 to $200 per piece. How can an Indian patient can afford to have that? So even 15 years ago, 20 years ago, we thought that, is it possible to make these lenses even in India at a lesser price? So we did that with the same technology, the same raw material, with ISO certificate quality, with the help of our own, the high school trained girls as people who can do these lenses, computer. We manufactured, we brought down the price to $150 to $5 a piece. $5 it is quality certified, and we are importing to more than 125 countries now, all the developing countries, and it is almost 10 million people now see through Aravind lenses, our own lenses. So that is the contribution. That is cut down the cost, and that is the social business. And in spite of $5, still there is a margin of profit. And that profit goes back to the service of the patients. So that is what we do.
Thanks ever so much for this talk.
Thank you very much.
Very inspiring, very thrilling, your story.
Thank you.
Wish you all good luck for your future. Thank you.